Would you mind introducing yourself?
Oh, okay. Hello, this is Barbara Hartel. I am Isabella's grandmother, and I had two knees replaced when I was 62 years old.
Sounds great. Do you know what was the primary reason for your double knee replacements?
Well, the main reason was I was very young and played racquetball at the age of 30 and was doing it so many times a week that it just injured my knees, and it was painful, but I had to live with that for 30 years.
All right, and did you
So
go?
Yeah, they made me wait till 62.
Did you try any treatments before the procedure, whether it be physical therapy, cortisone, or any other medications?
They didn't give me cortisone in my knees, but they gave me something that I think they referred to as rooster comb, kind of like a gel that they put in the knees. I had injections in my knees for every 2 weeks for three times. So for 2 weeks, then another 2 weeks, then another 2 weeks. And that helped for a little while. And it didn't do the trick anymore. And then they tried another injection series, and that helped for a little while, and that didn't do much good. It didn't last long, I should say.
Okay.
So actually, one time, my knees just kind of hyperextended, and I fell. And that's when they decided I better get my knees replaced.
That makes sense. So the treatments prior just weren't effective anymore?
No.
Okay. And you had the standard open surgery where they make one large incision, correct?
Correct.
And how did you feel going into the procedure? Did you feel well informed? Did you feel scared? Like, what emotions were there?
Well, I was well informed, but I was still scared.
Yeah.
Because it's still, you're not quite sure what you're getting into. But it was the best thing I feel that I did. I had both of them replaced, but they were 6 weeks apart.
Okay. And what did the recovery process look like for you? Did it, how long did it take, and what steps did you have to take to get through?
Okay, well, I had physical therapy. They came to my house. And after that 2 weeks of coming to my house, then I went to a company where I had to go get my physical therapy. And that was when I first arrived. I would go on the exercise bike and ride for about 20 minutes. And then the therapist would work on my knees, doing some massaging, and then he had to go into the exercise or weight room, I should say, and use my knees to push weights up. And I did that. I was with him for about an hour.
Okay. And how long did you go to PT for? Was it how many weeks, months?
No, I didn't go that long. I think I went for maybe 2 or 3 months, if that.
Okay.
Because I did a lot of it at home.
Yeah.
They had sent a machine that was passive aggressive machine, and that was, I thought, was wonderful.
Yeah. So they focused a lot on strength and different range of motion techniques, for sure.
Yes.
Okay.
Yes.
And how did you like that process?
I liked it very much. I don't think they do that anymore, but I did like that.
Yeah, for sure.
Because it makes you can control how, the range, and it makes you go a little faster than you probably want to.
Yeah, for sure. I think they do still use that, which is really helpful in overall extending, working on knee extension. Okay. And were you overall satisfied, following the procedure? Were you happy with, how it all went?
Yes.
Okay. And did you have any complications afterwards at all?
No.
All right.
So successful for me. I was very happy.
That is great. All right. Well, is there anything else you would like to add before we conclude the interview?
I don't think so. Well, I would recommend it. I know some people are afraid of it. And just like until you go through it, you realize that it's well worth going through that 6 weeks of hard, it's not 6 weeks of hard pain, but when you are doing the weightlifting and stuff, you're making your knees work when they really don't want to, but it's worth it.
Amazing. Well, thank you so much for letting me interview about this. It'll be really helpful, and I think people will find it very interesting.